Good afternoon and good morning to you if you are on the West Coast. My name is Dr. Jose Leon, Chief Medical Officer for the National Center for Health and Public Housing, a project of North American Management. I want to welcome and thank you all for attending today's webinar. This webinar is being recorded and the resources, slides, and other materials will be emailed to you after the webinar has finished. At the end of the webinar, there will be a question and answer session. I would like to thank you, HRSA, for allowing us to make this webinar possible. Before we get started, I'd like to ask all participants to please complete the post survey at the end of this webinar. And now I'd like to get started and introduce our speaker for today's webinar. Jennifer Genua McDaniel is the former Deputy Director of the Health Center Association of Nebraska. During her tenure, she developed and led training and technical assistance efforts for all the state's community health centers. She also served as the CEO of a health center in Iowa and Arizona. Previous to being a CEO, Jennifer worked in 2 FQHCs in Missouri as a health educator. Jennifer is a full-time consultant and provides training and technical assistance to federally qualified health centers and FQHCs localized around the country. She also works closely with the Bureau of Primary Health Care as a reviewer for operational site visits and technical assistance. She is bilingual in Italian and is currently working on her master's in public administration at the University of Nebraska, Omaha. Jennifer holds bachelor's and honors degrees in health education and promotion from Brock University, St. Catharines in Ontario, Canada. She also completed the Community Health Center Executive Fellowship Certificate Program at the University of Kansas. Without further ado, I'm turning the presentation over to Jennifer. Good afternoon, Jennifer.
Hi, good morning and good afternoon. Let's just show my screen here. Great. So thank you so much, Dr. Leon, for inviting me. This is a webinar. The first webinar that we did, we went through kind of the board governance and the statutory requirements for health center boards and community health centers. In this series, the second in the series, there have, in my work, not only with private clients, but also working with some of the national entities, there has been a lot of discussion regarding who does what in a health center. So, looking at what the CEO does, and then also what does the board of directors do. And so when Dr. Leon asked me to, put together this webinar, I thought, what a great idea, because that way I can reach a lot of people in this health center movement. So the next slide really just, I don't know if you can see my slide yet, but really just talks about the definitions and acronyms that we may be using today with regards to, different things, so that way and also the special populations funding if you are a health center that receives some additional funding, so those are also the definitions below. So just as a recap, really what are the statutory requirements for community health centers, not only for federally qualified health centers, but also lookalikes. And so those section 330 grantees. So as a recap, you have to hold the monthly meetings. You also have board meetings and board minutes. Anything that is HRSA related, so if you are applying for example, a change in scope or expanded services or a new access point, that application goes in front of the board, okay? And so there you need to have that board approval for that. The board of directors also has to approve the annual budget, the audit, and also the sliding fee discount program, and that also includes the nominal fee. And then also when you look at the long-term strategic planning, that includes, the health center missions, goals, plans as appropriate. So these are just kind of the first 4. The other thing the board of directors must do is looking at if you look, you have forms 5A, B, and C. So that tells you the services, location, and mode of delivery of those services. So the board needs to approve that. Any changes to that, that has to come before the board. The board of directors also determines the hours of operation. So if you, based on your needs assessment, you say, hey, we need to expand hours, or based on your need, you're saying, you know what, we may need to curtail the hours, that also has to go before the board. The board also approves the selection, dismissal, and evaluation of the health center CEO or executive director. The board as well looks at those policies. Remember, the board approves policies, not procedures, that are consistent with your health center program, and then also the applicable grants management requirements. And finally, the privileging and credentialing, that's something that needs to go to the board. So the credentialing is making sure that who you hire, that is those LIPs, they receive their credentials from, you know, an appropriate place. And then the privileging is essentially saying, I privilege them to practice within their scope of expertise. So that also goes to the board of directors. So these are just the statutory requirements for governance. So then the question really lies, sometimes there can be blurred lines between the CEO and board of directors. So really, who does what? And so I put together, hopefully you can see this, I put together kind of a table to see what the board does and what the CEO does. And so if you look on the left-hand side, when you look at those terms, the board develops a mission statement, but then when you look at the CEO, that CEO will communicate it. The board will guide the strategic planning with the help of the CEO, and other staff will create it, but then the board says to the CEO, hey, it's your, you know, this is yours, please run with it, and the CEO, through delegation, will implement it. The board will establish and approve policy, the CEO will implement it. You know, the board will go ahead and select and evaluate their one employee, which is the CEO, and then the CEO will make sure that he or she reports to his employers, the board, and talks and looks at the reporting and organizational goals. You know, the board will go ahead and evaluate the operations, but yet the role of the CEO is to manage that. And so when you look again, they review the quality of care, but the CEO will monitor that. And then the board represents that community interest. That's the reason why we have, when there's program requirement 18, board composition, that's the reason why that's there. They're representing that community interest. And then the CEO with his or her staff will represent the health center needs. So we're going to talk about some of these in detail. First, we'll look at what the board's role really needs to be with budget and finance. So normally and generally, the budget is usually prepared, you know, with the CFO, if you have one, a chief financial officer or finance director, with the CEO and other senior management. And so they put that all together. If you have a finance committee, that's usually, you can work through there. And then usually, you know, before the start of your fiscal year, that budget will go to the board of directors for approval. And so really what the board is doing is definitely looking at monitoring the program, making sure that there's sound fiscal policies and internal controls, you know, looking at making sure if there's procurement that's happening within the health center, that that happens appropriately. And one of the ways that they can monitor it is usually with the finance packet that they get at the board. You may have, it all depends on your health center and what you provide to your board of directors. Maybe one of those stoplight dashboards. So you look at, okay, red is the financial indicator that's not doing so well. Yellow, we're in the kind of the outside of the target, and then green is, yes, we're doing well. You may look at, you know, your statement of operations. So you're looking at your revenue, expenses, your productivity. And finally, you know, that board of directors assumes the fiscal responsibility of the health center. We receive, or as health centers, we have what's called a notice of award, and that is that legal document between the health center and HRSA. So the first page is actually 14 pages of that. Normally we just sometimes skim and look at the first page where it tells us, this is how much we're getting, how is it broken out with the budget. But if you really look at the rest of the 13 pages, that is the legal document that the board and the organization says, we are going to do A, B, and C and provide this quality or provide care, and in return, HRSA will provide you with funding to do so. So that is really a legal document between the organization and the funding entity. So really, what is the board's role in that health center program evaluation? So what does the board evaluate? And they're really looking at program effectiveness. So not only will they be does the board look at, the 19 program requirements, but really looking at the program evaluation as a whole. These reports, if you have a quality improvement committee, finance, nominating, maybe, these are the reports that actually come through the committees. And the board is looking at trending reports for, fiscal and clinical measures. So what I mean by that is, we have those measures, the UDS measures that we report every year, maybe meaningful use, looking at your diabetes goals, your hypertension, your asthma patients. And then fiscally, what are your days cash on hand? What are you looking at in terms of an accounts payable? How many patients are you seeing? And those are those trending reports so the board can see based on your targets that not only HRSA provides to you, but maybe looking at the MGMA goals and what you have as a state or nationally, how well you're doing. And then when you evaluate that, there may be some trends where, we're not doing so well. How can we improve it? And also, the other thing you want to look at, looking at your strategic plan, does that also work within your measures that you have told HRSA what you would do? So if you received recently the oral health expansion or those DSHE funds, for IT, I know everyone's waiting for, the new access point funding to come out. What did you tell HRSA that you would do? And so we have to also account for those numbers through that grant application. So that's something else that the board can monitor. And then, the CEO and his or her team will have quarterly calls with their project officer because they also have some measures that they're tracking as well with their dashboard. And finally, with regards to program evaluation, the board will say, to the CEO and his or her delegated staff, I noticed that, no-show rates aren't, doing so well. You're monitoring it in the quality improvement or CQI committee. Is there something that we can do? What could be the next steps? And that's where the health center CEO and his or her staff can operationalize that and say, what, let's try something out. Let's do a plan, do, study, act, and see what we can do. Do we need to do some open access? With regards to appointments or walk-ins, and then that will be reported back to the board. And again, that's all documented in your board minute meetings. Because remember, minute meetings for the board they're legal documents. So you want to make sure you have enough in your board minutes that actually tell a story. So what is the board's role with planning? So do they have anything to do with planning? And the answer is absolutely. They need to participate and approve the strategic plan. Really, that is your roadmap, based on the needs assessment of your service area or of your organization, what's going on, the climate of your state. That's basically what drives your strategic plan. And so are you monitoring those goals? And like we said, it's okay to say, we've noticed that, this goal isn't doing so well. Are there any restrictions to achieving this goal? Maybe in your state you didn't expand Medicaid, so you're not seeing that increase of patients with a different payer mix. And that's okay, because what's happening is you're actually looking ahead and seeing that the goal, you have the goal, and what ends up happening is you can adjust that and make modifications. And that is all about strategic planning and really looking at that and looking at those objectives. And that also can be driven in conjunction, so really the relationship with the staff or the CEO and the board. Because you know the CEO and his or her team, they're the ones that are in the weeds. They're the ones that work every day, and they're in the community and seeing patients and providing that comprehensive care. And so through the CEO or executive director, they allow the staff to operationalize those priorities. And they're the ones that probably can see the changes a little bit quicker, because we want the board to operate, to function more at a higher level at that 30,000 foot view. So what is the board's role in personnel? So we know that the board of directors hires, they have one employee, and that's the CEO or executive director. The CFO, CMO, they're not directly employees of the Health Center Board. And so what that board of directors does is that they hold the CEO accountable. And so they're going to monitor the effectiveness of their director, and this has to be based on a job description and something that's mutually agreed upon as an objective. So making sure that as a CEO, we're held accountable to what is told to us in our job description. And I know there's a section in all of our job descriptions that says other duties as assigned, which is great. But in this instance, especially when it's related to the CEO, and at times there are CEOs that perhaps have bonus incentives, you want to make sure that those incentives are tied to some objectives and that they're also attainable. And so, with that evaluation, the entire board, really will look at whether that CEO is completing those tasks. And more than likely, those tasks are tied to the health center's strategic plan. The other thing the board does is really looking at the salary ranges and personnel ranges, not individual salaries for employees. That's only your one employee, but it's the salary or personnel ranges. And that is also done when you're looking at the budget. So when you approve the budget, and at times this happens maybe in the personnel committee, so you're looking at ranges, looking at your markets, your trends. You want to make sure that that is being approved as well. What about the board development? So what does the board do with the development? And a wonderful resource that HRSA provided to us was that Policy Information Notice 2014-01. That is that governance pin that came out that really kind of honed in on a few things. And so it really talks about, the board needs to work together as a team to determine their structure and committee membership if they choose to have committees. They need to look at nominating and selecting new board members. And if you want to, as attendees, write this down, footnote, and I did not quote this in this presentation today, but if you look at PIN 2014-01, footnote 26 has some really nice things that HRSA has made some allowances in order to make sure that individuals that want to be on the board, there isn't a barrier, especially for those patients. So I would highly encourage everyone to go and look at that footnote because HRSA has made some allowances in order for individuals, if they need translation services, if they need babysitting, if they need, taxi vouchers to get to their board meetings. And so it has a really nice explanation with that. And that really is the board's job in working with conjunction with the CEO. The other thing the board needs to do is look at their own self-evaluation, and this is really important because it provides feedback to the entire board if there's areas of improvement. So hypothetically, let's say they did the evaluation and you have a lot of new board members that are on the line or have also have started that are fairly new. You really want to look at, is there some training opportunities? So as an example, maybe board members want to learn what the 19 program requirements are. Maybe every quarter you teach the board about Robert's Rules of Orders or how to make motions, or You don't have to be a board member you don't have to be a person that has expertise in finance to sit on the finance committee meeting. So maybe every quarter you learn about, what does a liability mean? What is an unrestricted asset? And really that type of education feedback comes through, excuse me, evaluation. What about public relations? And I think this is a nice one as well, is there's a lot of discussion right now regarding fundraising and board development, especially if your organization is looking at expanding, especially with the Affordable Care Act, or looking at a capital campaign. The board of directors, they're the voice for the community. That's the reason why we have 51% are patients on our board. And so when it's appropriate, really the board can go out working with the CEO. You set your goals. You can communicate with funders. You can, talk with community leaders and telling them about your health center. And, this is what we're trying to do. We're looking to raise this amount of money. And I think that's a wonderful way for board members really to show support. Even volunteering. Maybe there's a health fair that you would like to go to, and, you can introduce yourself. I'm a board member, but I'm also a patient. And I think public relations is a nice way as well to really show that support for the board. What about policy? So we know that there's a difference between policy and procedure, okay? So really what the board does, they will approve, they determine the health center's policies. And policies are really that broad guideline that provide a framework. So I like to give the example of clinical policies. So you're going to hypothetically have clinical policies that say if a patient were to come in your office with these symptoms, it's the policy, we have standing orders that we will do A, B, and C. The procedure clarifies those steps. So the procedures are patient walks in, patient, step 1, they get checked in, step 2, vitals are done, step 3, the nurse puts A, B, and C in. So the board doesn't get into the weeds with regards to procedures. They are going to be approving those policies. And the procedures are normally formulated by the staff rather than the board because, again, the staff are the ones that are in the health center working, and they know those workflows. And so there's always a question that comes up for me of, when should policies come up or be reviewed? And they should be brought to the board for review really on a regular basis, anything that changes. I know every year you really need to review and approve the federal poverty levels when it comes to your sliding fee discount program, but they should really be renewed, at a reasonable time. So we talked a little bit about what the board's role should be in some of those areas in the chart. Next, we want to talk about what is the CEO's role in planning. And so really, what should he or she do? And they're going to work with the board and gain the board's approval with the goals, objectives, and priorities. And this is usually done through the strategic plan. Because really, yes, the board is going to be creating this plan, but it has to also come the CEO and his or her designated maybe executive staff, senior staff, and other mid-level management. They know the climate of the community and of their company, and so they really will also help with those goals and objectives. And then the CEO will go ahead and once that strategic plan is approved, he or she will delegate responsibility with timelines and objectives and operationalize that plan. And then, however your health center does it, either once a month, once a quarter, every 6 months, come back to the board and say, here's where we're at with this goal. Here's where we're at. Here's, maybe some restrictions to achieve it. We've met it. We've had to change it. And here's what the next steps are. The CEO's role with budget and finance. More than likely, in general, that's usually done in conjunction with the CFO or finance director, also with other staff really looking at historical data, in the past, what were your expenses? What are your revenues? Are you getting any grants for the new year? You know, are there any other lines of businesses that are coming in that generate revenue? And so if a health center has a finance committee, all that work can be done within the committee, you know, all of the nitty-gritty type work that goes into preparing a budget. And then once that's kind of refined and honed, that budget is brought before the board for approval. And then every month, you know, financials are prepared for the board with some type of a discussion. And it really is up to the CFO and CEO and also the board, you know, if they need to make tweaks to some of the material that they're providing to the board. You know, are there some financial indicators? You know, what are you looking in terms of your statement of operations? You know, there is a new measure that just came out, the fiscal measure. I believe it's Health Center Program Grant Cost per patient. And so those measures, the fiscal measures, are all on the HRSA.gov website under the Performance Improvement tab. So you can look at those measures and see, you know, are we presenting those to the board? And also looking at productivity, whether it's broken out, you know, comprehensively, so looking at medical, dental, you know, and behavioral health. That also should probably be something that the board needs to look at. What is the CEO's role with administration and staff? So obviously the CEO delegates some of that because he or she, we don't want the CEO to be burnt out, and they are responsible for the day-to-day administration and activities of the health center. And again, these are duties that are clearly defined in the job descriptions. At times, they can also, I've seen them in bylaws. And so that CEO will go ahead and delegate the supervision of staff to, you know, his or her other senior leadership team or mid-level and so on. And this is also determined through an organizational chart, which is board approved. And so that also, every employee should have a job description, and that way, just as the CEO is held accountable to the board of directors, each of the staff members are held accountable to his or her supervisor. And that way, we can assure that there are high standards of performance that are being met. So essentially, the organization is acting as a body, so acting as a whole and working together. So looking at program evaluation from the CEO's role, the CEO really is going to help the board in that evaluation of the progress based, again, on the strategic plan and looking at, you know, if there needs to be revisions of the goals and objectives in order to improve that performance. And so the CEO really is going to look at that. Maybe there was, you know, you were anticipating a grant that you did not get. And so you're going to have to adjust a little bit, not only adjust your budget, but maybe the strategic plan, or can you make, you know, that goal that you wanted to implement telehealth or teledentistry, can you make it happen via another method? And so the CEO is really going to work with their team to secure maybe adequate resources, and then turn around and report back to the board on that status. What about public relations? So more than likely, the CEO, and I also put in here his or her delegate, is the chief spokesperson for the health center unless there is otherwise directed by the board of directors. But really the CEO will communicate and will work to the board to ensure that there is that community awareness, you know, with regards to the goals, the mission, you know, obtaining support for the center, you know, advocating for their health center, their staff, their patients, and really being that voice for the center to be able to serve the most vulnerable population. I got a lot of questions with regards to board of directors and health center staff interactions. And so I wanted to make sure that we talked a little bit about this. And so one of the things that is very important as board members, you know, every year you should be signing the conflict of interest. And if you look at program requirement number 19, which is conflict of interest, in your HRSA site visit guide, I think it's page 36 in the operational site visit guide, there are all these elements. that you need to make sure are in your conflict of interest. And so what it talks about that we need to make sure that as board members do not use their position to obtain employment in the health center, request preferential treatment for themselves, family members, or close associates. So there really is a fine line there. And then the other issue is, remember, you only have one employee, and that is the CEO. And board members should not attempt to resolve staff complaints. They should not circumvent the process. So perhaps you're sitting there as a board member and you're thinking to yourself, well, what should I do if a staff member comes to me? Maybe I'm a new board member, and you're going to have, especially in small towns or big cities, you're going to have relationships with individuals that perhaps are patients there that you know of. Perhaps you go to church with them, or you go to the grocery store with staff members. So really, what should you do? And there really needs to be that fine line there. So hypothetically, let's say you're in the grocery store and you see a staff member, and the staff member says, I really need to talk to you because I have a complaint against the CEO and I'm not happy with how things are going. So what should that board member do? So when confronted with a staff complaint, obviously you want to, express concern. I'm sorry to hear that. But what you need to say is, I really, you really want that complaint to be handled appropriately as outlined in, the personnel handbook. You really need to follow your process. And more than likely, they received an employee handbook. They hopefully they've signed off that they received it, but they really need to go through their supervisor, and follow that chain, especially if there is a human resource director there. The other thing that you want to explain to them is that you, as an individual board member, you do not have authority to deal with staff complaints. So that really is a protection for that board member. And so you are unable to attempt to mediate or resolve their complaints. You really need them to go through and follow the process. And lastly, hypothetically, let's say it's a grievance against the CEO or something that's legitimate. They really need to follow the process. There should be, I don't know if there's a corporate compliance officer or some type of compliance, but you really need to explain to them that there is delegated staff, for complaints against administration, and they really need to address their concern with that person or towards the CEO. So that is really kind of outlined. There really isn't anything in writing, but really if you follow this process, what also I've seen as a best practice is the board of directors developing a policy and approving this type of model. So that way it really takes them out. Because really the goal of the board is to drive the strategic plan and driving the health center. As you can tell, how health centers were operated maybe 5 years ago, 10 years ago, are not how things are now. We have the Affordable Care Act. There's the political climate coming up. We have value-based payment. Maybe your state is going through some changes. And so we want the board of directors of health centers to be focusing on, being able to be nimble and malleable to make those changes and not be in the weeds, and to be able to drive the strategic plan and provide it to the CEO in order to be able to delegate and to carry out the mission and vision. These are some of the resources that I thought that I use, and they're great. I wanted to make sure you had the link to the PIN 2014-01, so I believe you can click on it once you receive the slides and go to that footnote because it's really helpful, footnote 26. And then there's some other, the quality improvement link actually talks about the HRSA National Cooperative Agreement. And then NAC, the National Association of Community Health Centers, they updated in 2005 the Health Center Governing Workbook. I think it's amazing. They actually have embedded links. It's a PDF, so it'll take you right to where you need to be. And not only is it in English, but it's also in Spanish, and hopefully they'll be translating it to other languages as well. And finally, the last slide is my contact information, email address, and phone number. So if you need anything, you are more than welcome to call me or email me, and you can also contact me through Dr. Leon as well. So Dr. Leon, I'm just going to pass it over to you, and that is the end of my presentation.
Thank you, Jennifer, and thank you very much for this excellent presentation. We're going to start the Q&A session. If you have any questions, please submit it through the question box on your control panel or use the hand raise icon and your line will be unmuted. Any questions on your end, Brandon?
The only ones that I'm seeing, we got a couple throughout, are if the slides are going to be available. They are. They're going to be available on our website under the archived webinars page. And I can send a link to you now where it's going to be. I'm going to do a send to all of the attendees.
All right. Jennifer, I have a question on my end. Could you please provide more details regarding the board and CEO responsibilities, specifically the section about review of quality of care and monitor quality of care?
Oh, absolutely. That is usually done through, if you have, it's called like a CQI or quality improvement. And so the board not only is responsible fiscally, but also with quality. There are those HRSA clinical measures. So the board is going to be reviewing those, looking at those measures. So hypothetically, and the example that I use a lot, let's say the board reviews and see that depression screenings, your healthy people goal and your HRSA goal, let's say it's 95%. And you look at that, you're getting the report at the board and you want to pull it out and someone says, I've noticed that depression screening at 50%. And, the CEO says, I really don't know why, let's look at that. So the CEO will go to their designees, usually the medical director, the, quality improvement director, and they notice that, the front desk or the medical assistants or whoever, they're not providing is it PHQ-9 or depression screening. So they're going to do like a PDSA cycle, Plan, Do, Study, Act cycle on it, and then say, okay, for the next, 30 days, we're going to make sure that we provide this in the room before the prescribing provider gets in the room. And so they come back to the board and say, we've tried this, it's worked, we're not at 95% yet, we're at 75%. And so, that the board of directors will oversee that. And so you can do that with any of those qualitative or quantitative measures. That's just one example, Dr. Leon.
Thank you, Jennifer. And I have another question here on my end. Okay, Brandon, read yours first.
It's regarding policies and procedures. Usually these are both in one document, so that if procedures change, the entire document changes. Is there a framework for separating out the policies from the procedures?
Absolutely, and I have to tell you there's no right or wrong way to do it. So what I have seen in some other health centers is that the board will get just the policy, but you need to make sure that the policy has enough that the board understands what they're approving. And a specific thing is the credentialing and privileging policy, PIN 2002-22. The policy needs to have certain language in there. So that's one of the ones that I recommend that the policy and procedure be together. It's just that's my personal opinion. Just because you want to make sure that they're approving, and it's a program requirement of credentialing and privileging. But you can spread it, break it out. I've seen where it's just the policy and then the procedures on the next page, because you're absolutely right. Procedures change in the health center, regardless of what discipline they're in. And so it's just that policy. So I completely agree. You can split it out.
Great.
Any other questions, Brandon, on your end?
Not on my end.
All right, I do have one on my end. During a recent site visit, it was recommended that we include a board approval tracking process. Uh, do you recommend a board approval tracking process? And if so, is there a template or draft that you are aware of?
Absolutely. In fact, I have one. Dr. Leon, I can send it to you. It's actually, what I'll send to you, I have a board governance best practice model. It's beautiful. It's a governance manual. I can send it to you, and we can send it out to the group. You can do the tracking. It's just helpful to keep a reminder of what's been approved and what's not. Because, you know, the board gets a lot of materials, and it's hard getting an 86-page board packet. So what I'm thinking is it's actually a month, it's a calendar, and every month you just approve a different section, you know, clinical, operations, fiscal, that way. So I can send that to you later on as soon as this is done.
Great, great, and we are going to make sure that all attendees get that information. Thank you, Jennifer.
You're welcome.
Any other questions, Brendan, on your end?
Not on my end, no.
All right, thank you very much. One more time, I'd like to thank Jennifer for this wonderful presentation. And to all attendees, please complete the post survey. This helps the National Center for Health in Public Housing improve our webinars. You can also visit our website, www.nchph.org, and you will find information about upcoming webinars, monographs, training manuals, newsletters, information about our regional symposium, annual symposium, and information on fact sheets. You also can join our mailing list and receive HRSA updates, Medicare updates, professional funding opportunities, information on senior programs, resources and services, and information on upcoming webinars. You can also follow us on social media, Twitter, and YouTube channel. And if you have any training or technical assistance need, please contact any of our staff members, and we will be honored to help you with any question or concern. Once again, thank you very much for attending this webinar, and thank you, Jennifer, for this great presentation. Have a great afternoon.